If you just sprained your ankle, man, I'm sorry. It can be such a bummer sometimes. I know it always happens in the silliest ways, like your dog pulls you one way or you step and slip on something in a room you're really not even supposed to be in. I feel you, I've been there. But regardless of how you sprained it, I have some great exercises to help you rehab through it. Today is the first video of a 3-part series I'm gonna do on rehabbing your ankle sprain. The first video today is going to be on, I just sprained my ankle, what do I do? These are gonna be exercises to do within the first few days, all the way up to maybe about 2 weeks, depending on the severity of your ankle sprain and your pain level. So I have a few of my favorite exercises. Let's get started. Okay, so step number 1, you guys probably already know this and maybe are already doing it, is to ice and elevate your ankle. So if your ankle has swelled up the size of a softball, that's because you probably injured some ligaments or some muscle tendons in your ankle when you sprained it. Now, the swelling is a natural response that your body does to protect the area, but now we kind of want it to go away. So what I want you guys to do, take rest, get on the couch, lift your leg up, and let gravity help the swelling come down. So elevate your leg, and then you can wrap it in an ice pack or whatever you guys have at home to help the swelling reduce. Now you can do this about 10 minutes. Make sure the ice isn't burning your skin. You can actually do it about 10 minutes a few times a day, and you can judge it based on your pain level and how recently you sprained your ankle. Next, we are actually gonna work on a little bit of massage for the sprained ankle. So a lot of people, because it hurts, what they do is avoid touching it, avoid thinking about it. They just don't do anything to it. Now that can actually prolong the healing and prolong the pain because the brain learns, hey, this is a dangerous area. This is an injured area. I'm gonna keep it painful because I don't want to mess with it. That's your brain's response. So what we wanna do actually is massage the area. Now you can go as light as you need to. If this is really swollen and really painful, I'm serious, like literally just a brushing motion up. So this 1 can help with the swelling, and 2, decrease the sensitivity of the ankle. Now, as the swelling goes down and as you are a little bit less sensitive, you can actually get some lotion or massage cream and put a little bit more pressure into it. You can see I'm kind of wrapping forward around the ankle bone and behind the ankle bone as well. You can focus on where your swelling is the most. Now, some people have pain on the outside. Some people actually have pain on the inside as well. So focus where you are most tender. Again, you can kind of wrap around the inside there. Just massage all the way up into the calf if you need to. Do this about no longer than about 2 minutes. You don't want to irritate it. And again, this is a good one to do a few times a day as well. All right, now it is time to get that ankle moving. So what I want you guys to do, I'm just gonna use a pillow here to put underneath my leg so my foot's kind of hanging out in the air. We are gonna do what's called active range of motion. Now, all that means is we are gonna move the ankle in 3 different motions, okay? So the first one is going to be up and down. So we're gonna go up and then point down, and you're just gonna go as far as you are comfortable. So this might be a little bit tender or sensitive at first, like I said, depending on how swollen it is or depending on how recent you actually sprained your ankle. So you can do this about 10 to 15 times, as far or as short of a range as you guys can, okay? Now, the next one is actually gonna be side to side. That inward motion, again, might be a little bit tender. And one thing I want to point out, I see a lot of people do is going through the leg. That's actually not moving the ankle very much. So try to keep your leg still, and then we're gonna go side to side. Okay, last one is actually gonna be rotations in both directions. So we're gonna make a circle up and around. Good, and then after 15, you can go the other way. Now, depending on your soreness, you can do this numerous times throughout the day. Just make sure if your ankle's feeling it or if it looks more swollen, just go a little bit less range. So, my band fell on the table. Okay, the next one we're gonna do is a progression of the active range of motion. So if that is getting easy or is not painful anymore, what I want you to do, I have this TheraBand here. I'm gonna show you how to do those motions with a little bit of resistance. Okay, so the first one, you're gonna wrap it around the ball of your foot here and you're just gonna press down. So this is working a little bit more of your calf muscle. You wanna go nice and slow and controlled. Don't let anything go too fast, okay? So that's gonna be the down motion against the band. Now, to do the up motion, you're actually gonna bring the band to the side and use your other foot as like a base here. Okay, so now the force is kind of pushing down and I can pull up against the band. So now I feel it working on the top to pull up. Okay, about 15 to 20 times here. From this position, I can actually keep my right foot in the same spot. I'm gonna go out. So this is a resisted side to side motion. So I'm resisting going out here. And then you can switch it, pull it the other way, use your foot again, and pull in. So this is gonna be a 4-way resisted ankle motion, and about 15 to 20 times on these. Go nice and light, but you can put more force and more pressure through the band as you start to feel a little bit better. Now, this last exercise is going to be a great way to get you back into a weight-bearing position, get you back walking faster. So what I want you to do is just slide off. Say it's my left ankle that's sprained. You can put a little bit more pressure on the right side here. All I want you to do is work on shifting side to side. So most of my weight's on the right. I'm just trying it out. I'm pushing to the left, shifting back and forth, just as far as I can go, as much as I can tolerate. Now, if that's okay and you can kind of share your weight evenly, now what I want you to do is go forward and backward. So this is gonna bring the ankle a little bit more into the picture. We're gonna do a little bit more range of motion on it. Forward and back, about 15 times. Now the last one is gonna be a little bit scary probably, but in a small range, it's perfectly safe to do. And like I mentioned before, we really wanna show the brain that we can go in these ranges. That will help it heal faster. So you're actually gonna do a small twist of the hips, just back and forth. And if you notice, if you look down, you can see your ankle kind of flattening and arching up. Now the arch might be the scary part because it kind of feels and looks like what you probably did when you sprained your ankle. Just go as far as you are comfortable with going. That's perfectly fine. And you should notice it should get better with time and repetitions. So again, 15 reps on this one. All these exercises I have showed you today are pretty low level and pretty easy. They shouldn't be too fatiguing or too painful, so base it off of how you feel, but they are safe to do a few times a day. I really hope these helped you, and I hope your ankle is getting better. We gotta get you back up and moving and walking again. So I'll see you guys for episode number 2 on ankle sprain rehab.